Semaglutide is quite variable. So from one patient to the next, some patients it may work very, very quickly. Others it may take until they are at the highest dose. The clinical trial that was done by Novo Nordisk on the medication Wegovy, they saw the highest amount of weight loss and patients were the most successful at the highest milligram dose, the 2.4 milligram. We're not necessarily seeing that here at Plaza Aesthetics and Wellness. Usually within the first week, if not the first several weeks, our patients are seeing more immediate results. We recommend about 1 to 2 pounds of weight loss a week, which is great for long-term management. But the most important thing is, not necessarily the speed you're losing the weight, but that you're losing weight appropriately, you're not losing muscle mass, you're making those lifestyle changes to where you'll be successful on the medication or possibly even off the medication long term. If we have a patient that wants to lose weight much more quickly than 1 to 2 pounds, that may not be the best candidate for our services. We do have some patients that lose more than 1 to 2 pounds. We have several patients that have lost an average of probably 3 to 5 pounds a week and lost it very quickly, but that is not typical. What's most typical, what we're seeing with the majority of our patients, is about 1 to 2 pounds a week. I think if someone is planning on losing weight much more quickly, it's important to find out why. What is the basis for that? Again, what's most important is we want a healthy patient. We don't want our patient losing weight too quickly, losing a large amount of muscle mass. We want the weight that they're losing more to be body fat and then continuing to maintain their muscle mass. So sometimes you have to worry about that when you lose weight too quickly. This is one of the reasons we do monthly in-body composition analysis, which will help us follow our patients in terms of skeletal muscle mass and percentage body fat. Occasionally we'll have patients that will kind of want to go rogue and do their own thing. It's really important. The reason that you're coming here, the reason that you're coming to a physician-owned and operated med spa is for the expertise of our licensed professionals. For my expertise, I've been practicing medical weight loss since 2009. There are reasons that we recommend, certain oral intake to our patients, certain exercise. Everything that we recommend is evidence-based, which is very important. I know right now this is a fad drug. There's a lot of patients, we get a lot of phone calls, they want to lose 5, 10, 15 pounds. They're not appropriate for our program. You can't discriminate where the weight comes off. So, if someone comes to us and says, well, I need to lose 10 pounds off my legs. Well, first of all, their body mass index is not high enough that they're really an appropriate candidate. But second of all, it might come off your rear end or it might come off your chest, and those may not be the areas really where you want to lose weight. Good old diet and exercise are going to be recommended for those patients. But for our program, that's really, not where, we've decided to go with our program. And really at the end of the day, the most important thing is patient safety, patient satisfaction. Our patients here have been very happy with our program. It's very rare that we have a patient that maybe can't tolerate the medication. This is another reason we're seeing patients weekly. So, if there is an issue, we can address it immediately and hopefully then they can maintain the medication long term.